And just for a tiny bit of background, so it's good to know who's talking to you about all these things. I am an exotic pet specialist. I'm boarded in exotic pet medicine. This is something that we take pretty seriously, and something that we really try to get everybody on the same page. This talk is meant to be for anybody. So it is for everyone from exotic pet owners all the way up through exotic pet veterinarians or veterinarians who just want more information about exotic pets. So it's a little bit of something for everyone. If at any point you think that this is something that you want more information than what I'm giving and you would love to dig into it more, I'm happy to answer questions at the end. I'm also happy to talk one-on-one, especially with some of the vets and the vet professionals, about more of the details that we're talking about tonight. If this is something where you're a pet owner or an exotic pet owner and you really want to get more information, more lowdown, it's definitely a very good idea, if you can, to always set up exams, set up meetings, so we can talk about more things and dive a little bit more deeply into this material. So again, Mythbusting Exotics Pet Medicine, that is the focus for tonight. So when we talk about exotic pet medicine, the big myths versus the big facts, and why is it even important? Why do we care? The main things here is that we want to always make sure that exotic pets are getting the same care as everybody else. So when we really talk about how veterinary medicine in general changed, it's advanced a lot. Our vet med at this point has gotten far and beyond it used to be even 10 to 15 years ago. We're at a point where we're able to do MRIs and CAT scans and endoscopic surgeries and procedures. We're doing far more than we ever thought we would, which is fantastic and better for our pets. On the flip side of that, exotic pet ownership has also increased dramatically. So there are far more exotic pets in people's homes than there ever used to be. We always say that bunnies are kind of becoming the new cats. They're very easy that everybody likes to have. They're quiet, they're not as destructive, hopefully, as your cats are, and they're just kind of becoming a little bit more part of the family than they ever used to be. Biggest thing right now, though, is that exotic pet medicine has always historically lagged behind the rest of veterinary medicine. So we've always found that whether it's because of a lifespan that is expected for these pets, or if it's because they're just small, or for whatever reason, they don't always get the same time and attention as our cats and dogs do. So it's very nice for us to finally be able to hopefully be offering better exotic pet medicine now than we were before. Right now, we're going to talk tonight about breaking down some of the dogmas of exotic pet medicine. So trying to bring exotic pet medicine into the same scope and span as what we do for cats and dogs already. We are going to talk a little bit about mammals, birds, and reptiles, so I promise stick around. You're not going to get left out. Hopefully you hang on till the end for our little scaly friends. So I think the biggest myth of all, and the one I wanted to tackle right off the bat that applies to all of the species, wellness exams. Exotics has historically been getting on the easy side of things, where they don't always get wellness exams. I feel like at this point, I've heard every reason for not bringing an exotic pet in for wellness from both pets, both owners and veterinarians, not specializing in exotics. So everyone has given me a different reason. I've heard, I don't want to stress him out by bringing him in. He's fine. There's nothing wrong with him. Why should we bother? He's fine. Look, he's healthy. Or there's no shots for him, so why does he have to go? What's the point? Or all the vet's going to do is look at him, tell me he's fat, and send me home. So we're trying to get beyond that. There's a little bit more to it, and we couldn't be more wrong about, what is the point in bringing them in? Wellness exams are just as important as they are for other species, for cats and dogs. Honestly, even when we look at these exotic pets, their exams can consist of a lot of different things. We obviously do a physical exam whenever they come in, but every species is going to get something different. One of the most important things that we do in these wellness exams is to talk about their husbandry, so their cage or tank setup, their environment, and their diet. In exotic pets, it's a well-known thing that a lot of their diseases and their illnesses come from inappropriate housing and inappropriate diet. And there's so many nuances to that. Every species is going to be a little bit different. There's going to be ones where maybe light bulbs are more important. There's ones where temperature is more important. There's ones where diet can really cause serious problems. And we all know that everybody has done tons of research on these exotics before they bring them home, hopefully most of the time. But sometimes the internet is a dark and scary place, and it's full of conflicting or different information. So it's kind of nice to let us be the guide and give you that information so you don't have to feel like you're sifting through this whole set of different conflicting information trying to find what's right. And in general, of course, there's different things. The best recommendation we can ever make is to get them seen by a vet who specializes in their care so that we can catch problems first. For some pets, there's blood work. For some pets, there's parasite testing. Some exotic species do get vaccines. So you're not going to know many of those things unless you come in for your wellness, and then we can actually talk about it and talk about why it's so important. So even when we talk about different species of exotics, right? For example, if we're bringing in a rabbit for a wellness exam, there's going to be more to it than just looking at the bunny, listening to the bunny, and sending you home. It's very, very important for rabbits to get annual blood work once a year, to get different parasite testing, hopefully once a year, but at least once in their lifetime, so we know what they're carrying. Because rabbits can develop a lot of different problems, from liver and kidney disease to different parasites. So it's kind of important for them to come in. There's also some vaccines that we do for bunnies that not everybody knows about. So again, it's something that's a very good idea to bring them in so we can get on top of that early before they ever have a problem. Again, for pet parrots, it's very highly recommended for them to come in once a year for an exam, because in these birds, they can live so incredibly long, some of these species. If they're living up to 60 years old and they've never been to a doctor in their 40s, that's like being 80 years old and going to your doctor for the very first time. They're going to have a heart attack, first of all, and then they're going to give you a lot of scolding about why you never came in. Parrots are very similar. They can carry a lot of the same diseases that people can get, from heart disease, fatty liver disease, and all of these things are fixable and treatable if we catch them early. But if we wait until they're having an emergency, these problems can be really hard to get on top of and hard to tackle. So it's a lot easier for us to intervene early while we can and catch these problems early. Again, even for reptiles, when we start talking about what's the point, right? He's a lizard. What's the point in bringing him in? Again, exams are really important. They give us a lot of details about what could be wrong with these guys. Blood work, fecal testing for parasites. And again, reptiles do tend to get the majority of their problems, unfortunately, from deficiencies in their environment and in their diet. So when we have these problems, it's very hard for us to fix them once they've gotten too bad. Much, much easier for us to fix them early, catch these problems when these animals are young, and then hopefully they never have an issue and they never get sick, instead of having to fight that uphill battle of trying to make them better when we're already too late in the game. Even tortoises now, a lot of tortoises can get bladder stones and they'll never show us that they have an issue until the stone is enormous and needs to be surgically removed. So some vets even recommend doing one x-ray of every tortoise once a year just to make sure they don't have a stone, so we don't have to wait until it's so big that they've stopped eating for months and now they're really sick and now we're playing catch up. Again, it's a little bit more important than I think people used to give it credit for, but in a good way. So kind of moving on, wellness exams are very important. That is the bare minimum. But now getting a little bit into the nitty and gritty, the furries and mammal myths. So the big one, the big, bad, and scary, the one that everybody worries the most about in most of our small mammals, GI stasis. GI stands for gastrointestinal. So this is the one where rabbits or guinea pigs or chinchillas, they aren't eating normally, they aren't pooping normally. And if you start Googling it and you start searching, it's really, really scary. The myth that we have been trying to get away from for many years now, that GI stasis is just a GI disease. It's specific to the gastrointestinal tract. There's very standard treatment. If you do those things, it's either going to get better or it's not. Wrong. We've moved beyond that at this point. Even when I was in school, different things were being taught than what's being taught now. The fact that we know now that we've been doing better and better medicine for rabbits is that GI stasis is often caused by the stress hormones that are released because of other diseases. So really, GI stasis is going to be more of a symptom or a syndrome of other diseases and is caused by stress, as opposed to being treatable just by GI medication. It's something where we're often looking for the other causes of stress or discomfort, not necessarily just treating GI problems. So when we go into GI stasis a little bit more, what is GI stasis really? Clinically, GI stasis is an animal that has a poor appetite, or inappropriate defecation, so not producing enough poop for at least 12 hours. So if it's less than 12 hours, technically we wouldn't necessarily call it GI stasis, but it could be on its way there. If it's been more than 12 hours, this is really what we're seeing. But medically, what's the difference? So clinically, that's one thing. Medically, GI stasis is less movement of the intestines because of increased stress hormones. So it's the slowing down of the intestinal movement because of other stressors in the body. And again, stress can be anything. Stress can be physical change. It can be environmental change. If you have a bunny that is a sensitive flower, sometimes something as simple as literally moving the houseplant from one side of the room to the other can be enough to stress them out, or having a dinner party where people are over at the house. Or it can be physical stress, like being sick with something else or being in pain from something else. And really, again, stress hormones will cause a lot of adrenaline release, which then causes less GI movement and lowers their stimulus to drink water. So then they become dehydrated, which allows more food and fur and things like that to become stopped up into their gut, kind of like a clogged drain. So that can be uncomfortable, which can then make the problem worse because it releases more stress hormone, and they kind of create this snowball effect where they just keep making themselves worse and worse and worse. And if we don't intervene, it can be really hard to get them out of that cycle. The first question that we always ask, we just said it doesn't have to do with intestines. Now we're talking about maybe it stuck in the intestines. It can be a little bit of both. So we approach GI stasis in a few different ways. When we're really talking about possible causes of GI stasis, obviously one of the first ones everyone asks is, what is he parasites? Yeah, absolutely. Parasites are one of the possible causes. They can be specific, worms from the GI tract, or they can be a little bit more nuanced where it can be something a little bit more broad and systemic. Like in rabbits, there's one specific one called echiniculi that can cause dizziness, nausea, and make them really stressed, and then they don't want to eat well and they spiral themselves. Again, systemic infections, anything that stresses out their system can make them stop eating. So respiratory infections, urinary tract infections. Again, one of the first ones people say a lot, what if it's his teeth? What if his teeth are bothering him because he's not eating? Yeah, absolutely. Teeth can be one of the reasons that they're not eating, but it's a lot more common in older rabbits. We don't expect that from a young rabbit because they're just not old enough to have dental problems. So in a young rabbit, it's rarely going to be the first thing we look for. Even different organ diseases like kidney failure, heart failure, liver problems. They're all things that cause pain, cause discomfort, cause dehydration, and then can start this whole process off. And of course, eating foreign material in cats and dogs is the first thing we look for when a dog is vomiting or not eating well or anything like that. Rabbits do sometimes eat foreign material. It's just not nearly as common as it is in cats and dogs. They'll probably chew on your walls and your wires, but they're not going to eat enough of something to usually cause a problem. And again, age-related diseases, cancer somewhere, arthritis that's making their joints really hurt, anything that's going to stress their system, and then environmental stresses. So they just got home to your house from a different situation 2 days ago and they're really stressed out. Now there's kids in the house. They've never lived with kids before. You just brought home a puppy or a baby or something. Something major has changed in their world and it's really stressing them out. Sometimes they're not going to eat well because those environmental stress catecholamines can really change things. So a little bit about obstructions, just to dig a little deeper into it. Again, they're just not always particularly common in compared to cats and dogs. They really just don't tend to get stuff that gets stuck because they don't eat those kind of bad things like rubber squeakers and hair ties and the tinsel off the Christmas tree. Even if they do, obstructions in these animals less commonly require surgery than they do in cats and dogs because of the nature of their GI tract. There have been studies that also show that with the proper medical management for these cases, you can actually get them through it without having to take them to surgery. Every veterinarian who's ever worked on a rabbit knows that dealing with their surgical tissues is like trying to suture wet tissue paper. It's no fun for anybody involved. It's very challenging to do, and it's not always very successful. So we really have found a lot of ways that we can manage them medically without having to take them to surgery at all. We can hydrate them. They can pass these things on their own more often probably than cats and dogs do. And again, finding the cause in the first place. So even if we have a rabbit that we took x-rays, we did ultrasounds, we know all the reasons, we can see that there's something blocking their intestines, we have to still ask, why did that happen in the first place? Was there already fur that he was passing through his GI tract, but then something else flared up, something else made him have an adrenaline release, drink less water, and made it get stopped up and dry in there and got stuck? And the obstruction is just, again, a symptom of something else that was already going on. So again, to kind of recap, myth versus fact. The myth is that stasis is simple, it gets better with really simple home remedies. And a lot of the time, if you go online and you start going through Facebook groups, Reddit groups, things like that, you're going to see a lot of force feed them critical care, which is the type of food that we sell that makes up for their eating, and give them baby gas drops because they're bloated and they're gassy and it's uncomfortable. So we want to get rid of the gas. And then sometimes there's even things about pineapple juice and feeding pineapple juice to help their digestion. Most of that's not really supported by any kind of science. There have even been recent studies that show that giving baby gas drops like simethicone does absolutely nothing for the motility of the rabbit GI tract. So if anything, we're actually covering up a symptom by covering up maybe the gas that's being produced when there's only gas buildup because something else is making their GI not move correctly. The fact is that there's so many different causes of GI stasis and so many different treatment options that it's really almost impossible for us to figure out why they're like that in the first place unless we do a little bit more digging. It's just a more complicated disease process than we ever used to think. That's why most of the time, most vets who are familiar with these kind of cases and this kind of disease often recommend hospitalizing the animal so that we can get better diagnostic testing done. We can take extra x-rays, do more blood work, really find a reason for what's going on in the first place. And so we can change our treatments over time. We want to know, based on the patient's responses, okay, so he's getting better, we can back down on this pain medication, or he still seems really uncomfortable, maybe we have to add a new medication on. It's a little bit more nuanced than just kind of sending people home with a goodie bag of 7 different medications and saying, okay, use all of these if needed. Then we're just leaving, our owners at home questioning, well, do I need this or do I not? How do I know it's working? How do I know he's going to get better? There's a lot more to it. And even then, if we do send animals home with syringe feeding or we do it in the hospital ourselves, we have to be very careful with it. There's a really high risk that these patients, if they don't want to eat the food, so if they're nauseous or painful, we could be trying to force feed them and putting stuff in their mouth, and they might not be swallowing it. They have a really high risk of aspirating that material and giving themselves pneumonia on top of what we were trying to treat in the first place. They can literally make themselves so much worse in this process, which is a little bit scary too. So that is kind of our quick summary on GI stasis. We're going to move right along. The next topic, bladder stones in guinea pigs. And this one, again, is something we have seen a lot of more recently in exotic pet medicine, but our understanding of it has changed so much in the last 5 to 10 years. So again, the myth of bladder stones in guinea pigs. Myth is that high calcium foods cause bladder stones, and restricting high calcium foods prevents bladder stones. That is what was taught when I was in veterinary school. It is still what I hear on and off all the time, now, more recently, and it's just not been proven to be true anymore. There's more to this disease process than we used to think. Food, we now find, and we'll go into why, that foods that are high in nitrates and even vitamin C can actually make bladder stone formation more likely, and that restricting dietary calcium can actually make bladder stones more likely to form. So it almost goes against what we used to think. The other side of things is that genetics matter. There are plenty of guinea pigs out there who eat all of the bad foods that they shouldn't, whether it's the old recommendation or the new recommendations, and they don't get bladder stones. And then once in a while, there's a really unlucky one that just keeps getting them no matter how we change the diet. So just like people who get kidney stones aren't supposed to eat certain foods that are high in certain enzymes, certain amino acids. Everybody else can eat them, just not that particular person. The same is starting to be understood for guinea pigs and even for rabbits. Not all of them are going to get this condition. They usually have to have some kind of genetic problem where they're not metabolizing things correctly. So it's a little bit more nuanced than we used to think. So again, bladder stones in guinea pigs in the last 30 years, the research showed that the majority of bladder stones that were evaluated were actually calcium carbonate. And that comes from a very recent retrospective study where we went back and reanalyzed the results of 30 years worth of stones that were submitted to different labs around the country. However, it used to be understood that these stones were calcium oxalate, which is a different type of stone. And the reason for that difference actually comes from a change in how we dissolve and identify those stones over the years. So 20, 30 years ago, we were using different methods to dissolve them, and we were ending up with this result that they were calcium oxalate. Now that we've updated our methods and we're getting better results, we're finding that even those old results that said calcium oxalate were often incorrect. If you go back and reanalyze them, they're calcium carbonate. And that makes a big difference when we talk about how those stones are formed in the bladder. So this one is a little bit chemical, a little bit more scientific. Bear with me, I promise. We're going to get through this together. It's not going to be that complicated. It just looks a little scary. So when we really talk about how do these stones form, the new research, the new understanding is that an excess of nitric oxides in the food is then digested through the mouth, through the stomach enzymes, and even a little bit how it's broken down in the normal function of the kidney. Those nitric oxides eventually can cause more sodium retention by the kidney. And when that happens, it causes more calcium to be excreted into the urine. So that means that more calcium is being dumped into the urine, specifically not because of calcium that's being eaten in the diet, but by this nitrates in the food and the nitric oxide that's being taken in. Now that's important because limiting calcium and limiting nitric oxide and nitrates in the food are two very, very different things. And we'll get into that in a second too. When we also talk about vitamin C, again, it's a catch-22. Everybody who does exotic specific medicine has already heard the story about how guinea pigs are absolutely required to have vitamin C in their diet. And that's true. Guinea pigs are, for a very special reason, guinea pigs are terribly designed creatures. Whoever figured them out did a terrible job. Guinea pigs lack an enzyme that allows vitamin C to naturally be made in the body. So guinea pigs will literally be like pirates with scurvy from the old tales if they don't eat enough vitamin C in their diet. They get very, very sick. And that's always been a very well understood thing. So now we're saying that too much vitamin C can cause these problems. So it is a balance. We can't just stop giving them vitamin C, but we need to maybe balance the other things that vitamin C interacts with in order to prevent too much calcium from being deposited in the urine. It's a little bit more nuanced. Again, when we talk about how these stones are formed and why calcium restriction actually makes it worse. When calcium and oxalates, which again, we used to worry about more, but when oxalates and calcium are eaten together, they actually bind in the GI tract. So that prevents the oxalates from being absorbed into the body. And then the kidneys don't have to filter them back out again. So calcium and oxalates are together in foods like kale and collard greens, those really dark leafy greens you see in those special like organic section of the grocery store. However, if you restrict calcium from the diet, it actually increases the amount of oxalate that is absorbed into the intestines and into the bloodstream because it's no longer able to bind and form its own compound, which means that more oxalates get excreted into the urine. Even in the picture, we can see this. If we're looking at this x-ray on the side, we have our little guinea pig here, and he's got a big old bright bladder stone sitting in the back of his bladder, kind of down by his legs. You can see that big old rock. Looks like he has to lay an egg. So when we have oxalates that deposit into the urine, while they're no longer considered to be the cause of the stone, we just said that we've kind of changed how we understand these stones. Calcium oxalate stones are no longer believed to be as much of a problem. The oxalates in the urine aren't necessarily going to create a stone, but they do change the pH and the chemistry within the urine, which can make stone formation more likely. So they're not causing the stone to form, but they can make it more common. So restricting the calcium is actually worse for this condition as opposed to better. So again, what does this really mean in bare bones terms for our guinea pigs? What foods can they not eat? High nitrate foods are a pretty long list, but pretty easy things to avoid. They're also usually the cheap and easy things that a lot of people feed. So plain lettuce, it is probably one of the top causes of this because so many people feed romaine and red and green leaf lettuce to our rabbits and our guinea pigs because it's cheap. You can buy it in bulk. It usually lasts at least a little while in the fridge, but lettuce is very high in nitrates. Celery, carrot tops, which a lot of them like, cabbage, arugula, parsley is another guinea pig's favorite. But all of these things, the fennel, the beet greens, the endive, they contain a lot of nitrates. And again, when they eat those nitrates and they digest them, they affect the kidney and cause more calcium deposition into the urine without necessarily having to eat a lot of calcium. The other thing is that oats, millets, and corn can also contain really high nitrates. That is why part of why a lot of veterinarians will not recommend using the Fiesta mix, Tropican mix, guinea pig pellets that look really fun on the shelf that are full of dried fruits and oats and corn and things like that. So besides the fact that it makes the guinea pigs fat, it also can make them more likely to develop bladder stones. So again, going back into a little bit, the myth versus the fact. The myth used to be, don't feed anything that was high in oxalates. So we always used to tell people to avoid kale, avoid collard greens, avoid dandelion greens. Everyone was always very, very strict about this. We really find that we don't have to be anymore because our understanding is different. Again, the other thing was to calcium restrict guinea pigs that have had stones. So again, people would avoid these kale and the collards and stuff like that have a lot of calcium. And they would feed a lot of herbs like parsley because they thought, okay, yes, there's no calcium in parsley. We can feed that pretty freely. Again, the understanding is just different. Foods that are high in nitrates should actually be the ones that are restricted. That would be that list that we just had on the previous page. But again, lettuce, celery, carrot tops, spinach, cabbage, arugula, parsley, and then the Fiesta mix pellets. So the things that have a lot of corn, a lot of millet, a lot of kind of add-ins that are crunchy and yummy and delicious, but unfortunately very bad for them. So using high quality pellets that don't have those mix-ins. So a regular, and this is not some plug for Oxbow, they just happen to make a good pellet. Regular plain Oxbow pellets or small Pet Select pellets that are plain that don't have mix-ins are very healthy for guinea pigs for a lot of reasons. And again, it's almost counterintuitive, but foods high in calcium would be more beneficial because they bind to the oxalates that are in the GI tract already, so that less of them get deposited into the urine. That is our kind of quick summary on guinea pig bladder stones. And again, if there are questions at the end of anything, if there's more that I can get into, I'm kind of trying to get through these guys quick because there's a bunch of different topics. But if there's anything we want more information on at the end, we can always go through and kind of talk about things. So moving away from the mammals a little bit, moving into our feathered friends, the bird biases. When we start talking about bird biases, I'm sure that a couple of these topics are probably going to be a little bit touchy with people, but I think that is why it is so important to talk about them, because they've been misunderstood for so long and a lot of bad myths have been running rampant on the internet. The first one, feather plucking in parrots. Why is it important that we talk about this one? This is a disease that has been very misunderstood for a very long time. We've come so far with it. And it's just better for the birds if we can get on top of it early. So, feather plucking in parrots. The myth is that feather plucking was caused by stress or boredom, and that if feather plucking is severe, your only option is stick a bird in a cone, put them on some antidepressants, and that's it. You're stuck with it. You've got a bird that plucks. You're never going to get better. This is your life now. We know better now. We know that that's not true. Feather plucking is a complex, multifactorial disease process that's often a symptom of other underlying problems. So it's not just stress. It's not just boredom. We know so much better than that now. And there's so many medical and behavioral options that are available to try to get on top of this, all depending on what the initial cause is. So, talking about feather plucking, 20 to 30 years ago, even when I was still in school, they were just getting away from this topic. All you would do, you had a bird that came in that's pulling all its feathers out, you put a cone on him so he can't reach his feathers. They would put them on mood modifiers, which were literally human antidepressants. And they would throw their hands in the air and say, I guess that's it, you have a feather plucker, sorry. He must be bored. Now you're stuck with this problem. However, in the last 5 to 10 years, so much research has been done that proves that feather plucking is a really complex process. It's both learned behavior and a symptom of underlying illnesses. So this is kind of similar to when we talked about rabbits that are getting into GI stasis. So a rabbit that stops eating and pooping normally, we now know probably has an underlying problem. We want to go looking for that underlying sickness. We need to figure out why it's happening, not just treat the symptom, but figure out what's actually causing it. Feather plucking is now considered basically the same. There has to be something else. It is a bird trying to communicate to us that something is wrong. I would tell our owners and our clients, think about your check engine light in your car. Your check engine light comes on, it tells you to look under the hood. It tells you something's wrong. It doesn't mean that thing is because of the specific engine. It doesn't tell you exactly what that problem is. It just says you should really go looking, there's something wrong. Feather plucking is the same. It's a red flashing warning light. It's not a primary problem on its own most of the time. So the many causes of feather plucking. Infections. So again, bacterial infections, fungal infections internally, viral infections that can cause different symptoms. Again, pain, so arthritis in different joints. Birds are egg-bound. I have seen birds that are arthritic that pluck over their knees or over certain joints in their wings because it's bothering them and they don't know how to express that. Different organ diseases, so kidney failure, fatty liver disease, heart disease, and fat in the arteries. I've seen birds with kidney failure that pluck on their back over their kidneys. We've seen birds with heart disease that pluck only over their chest and their front end because that's where it's bothering them. Even some toxins can sometimes cause feather plucking. So we've seen birds where we can't figure out why they're plucking. We've done every test under the sun. We've looked for absolutely everything. And then it turns out that they have plastic toys in their cage and they've been chewing little tiny pieces off for the last 20 years because it's fun to do that because they have a beak that's good at destroying everything. And as those toxins leach into their system, it causes just a little bit of abnormal feeling in their skin, changes in their metabolism, and they start pulling feathers. Metabolic diseases. So again, these things can be because of diet. They can be a genetic condition that bird has, but low calcium, high cholesterol, low vitamin A, all of these things can cause problems. Even low calcium can cause tremors and twitching of the muscles, which can then make them feel funny and make them pull feathers. And lastly, of course, stress and behavior. There's different types of stress, though. Again, 20 years ago, we used to just say, these birds must be bored, that's all we can do. We know so much better now that most of these birds, or a lot of these birds, have at least some amount of hormonal stress. Hormonal stress is probably pretty underappreciated in a lot of our parents, but the more we dig into it, the more we find. We really find that birds are flock animals. They have very specific ways of interacting with each other. And a lot of the time, our owners are giving unfair or really mixed signals to their birds. The standard golden rule is that a bird should be petted from the top of their head to their shoulders. Anything else is for their mate to touch and not their mom. So if our owners are petting them on their body, under their wings, kissing their belly, all these things that we think of as being really cute and really sweet and good bonding experiences, sometimes we're giving the bird the wrong signal. And then those birds get really frustrated, hormonally frustrated, since they're all bad teenagers in the end. And they can start ripping all of their feathers out because they don't know how else to express that. Or they're just really bad birds and they bite their owners all the time and then they get frustrated with them. But we're the ones giving them the mixed signal. Again, there's just so many nuances to this disease process. So when birds are plucking feathers, step absolute one, make an initial visit. Because if we can start ruling out causes, we don't even necessarily always have to get into a bunch of diagnostic tests. We don't always have to get into all of these different, working them up for different things. There are so many things that a lot of the time we as veterinarians can find just from getting your history. There's so many simple things, adjustments in their diet, changes in their toys, changes in their environment, and different behavioral changes, training changes that we can implement that might be able to make this process stop at home without having to dig into all of these other causes. But we're not going to be able to go through those things if we can never see the bird, if we can never talk to the person in person, one-on-one. It's very hard to go through all of these different things and really nitpick the cage setup, the diet, the types of toys that are available. How do you interact with your bird? That's the stuff that we take sometimes half an hour just an exam to go through all of these things that can be problems and really figure it out. And then, of course, if we can't figure it out, if we try the simple at-home changes and nothing's working, or if we have a good reason looking at a bird to say, okay, no, I really think she could have this problem, we should do some tests. Diagnostic testing is important. There are cases where we're not going to get that answer unless we start ruling some things in and out. And sometimes it is just a matter of getting negative test after negative test. I'd rather get negative tests and not diagnose the bird with something really bad. But sometimes if we don't do that, we're never going to know, and we can miss an easily treatable condition. And again, it's important to remember, but complicated or chronic cases can take months to get better. Some of these birds have been plucking for so long that, yes, it started as a calcium deficiency or hormonal stress or something like that, but now it's turned into a learned behavior. Now it's turned into a habit that they formed. And it's the combination of finding the problem and solving the problem, but also retraining them and really putting in the time, the effort, and the energy to get to the bottom of this problem and try to fix it, and also train that bird to do something with their beak. We always say that the beak should always be busy. A bird's beak should always be busy. They should always be doing something with it. Those are where sometimes people will say, well, isn't he just bored? I got him lots of toys, but he doesn't play with them. Yeah, because he probably doesn't want those toys, or he's never had them before and he doesn't know what to do with it. So sometimes we also come up with different ways to create foraging toys for birds, things that can distract them so that they're going to break this habit of anytime they have something to do, they start pulling feathers. We want to give them something to do. So we might change their diet to be healthier and then put their junk food and their treats in a toy that they have to work really hard for. Because now their beak is going to be busy doing that for hours at a time instead of ripping their feathers out. There's so many things that we can do. There's so much more to this. So again, trying to get through kind of all these different topics as we go here. The myth: feather plucking is caused by stress and boredom. Once it starts, it's impossible to stop. You're stuck with it, you have a bird that plucks. We just know that that's not true. Feather plucking is such a complex process with so many different facets, but it can be controlled and stopped depending on the cause and the recommendations that we make. It's very, very rare for specialist bird vets, or most vets at all, to recommend using cones and mood modifiers in birds anymore. Most boarded avian veterinarians balk at the idea of having to put a parrot in a cone, and most of us would do absolutely anything in our power to not have to do that anymore. We've gotten so far away from it. Cones and parrots are seen, it's almost like saying, giving somebody a ton of poison ivy and then putting them in a straitjacket. Like, it is just going to turn this bird into a psychopath. They're going to be so stressed. They can't access their feathers. They can't even groom themselves normally. And also something's bothering them that makes them want to pull the feathers, and they can't do anything about it. It's got to be the most frustrating, absolutely terrible thing for that animal. And so it's really, really hard for them. It's hard for them to understand what's really going on. And it kind of creates a behavioral nightmare for most of these birds. So again, most bird vets are not going to do anything with cones anymore. We've really just gotten away from it. The next incendiary myth that I know people don't necessarily want to hear, but they need to hear: healthy diets for parrots. The myth that we have been working off of for 30 plus years is that parrots eat anything that we eat, and that feed diets are an inexpensive, healthy, and supplemented base for a parrot diet, and that's perfectly fine and very healthy for them to eat. We are so wrong. It is so far off. We have come so very far in the last 30 years on parrot diets. It's almost backwards if we're still feeding them seeds and things at this point. Parrots ideally should eat a balanced, formulated, pelleted diet with fresh fruits and vegetables as their diet. We know that parrots that regularly eat seeds, nuts, and human foods, aside from fruits and vegetables, are highly likely to develop heart disease and fatty liver disease. It is known, it is proven, there have been plenty of studies at this point. There's just no good reason anymore for us to be working off of the old myths, but there are still people who do. So we're going to talk a little bit about why this is so important. For many, many, many years, even veterinarians recommended feeding human food to parrots. It's a misconception that was taken from the wild. We used to always say, oh, well, look, parrots are foragers, right? They like to forage for their food. They eat anything they can get access to in the wild. Look at this parrot in the garbage in Australia, this cockatoo that's eating whatever's in somebody's trash can. But, and I can say, even in the last 5 years, I've seen it written in medical records by veterinarians that they recommend that people set aside table food for their parrots. And that scares the bejesus out of me, because we just know at this point, we have improved our parrot medicine so dramatically that our understanding of their nutrition has improved with it. The more we look at these birds, the more we do their blood work, the more we do their CAT scans, we've been understanding their nutritional needs a lot more deeply. And we've been finding all of these problems that come from an inappropriate diet. Again, 30 years ago, we just had what we knew. We knew that birds eat bird seed, birds love bird seeds, and so we should feed parrots bird seed. Why not? They like it, they eat it. Look, he also likes chicken wings, and he also likes to drink my coffee with me in the morning, or he likes to eat cheese with me, whatever it is. He eats my quesadillas. Just because they eat it doesn't mean it's good for them. And in the wild, even though sometimes we see that these birds forage for things, whatever they can find, it doesn't mean it's good for them. It doesn't mean they should be eating it. It's like your raccoon eating out of your trash. If your trash wasn't there, he wouldn't be eating it. So again, so many studies have shown that diets that are high in fat and carbohydrates cause heart disease and fatty liver disease in parrots. This is known. It is well known. It has been documented. There have been studies on hundreds of birds at this point that show that this is true. So it almost becomes a deficit on our part if we are not recommending that people feed the right thing. We're starting to miss a major disease process, and no vet wants to make their living off of CAT scanning birds with heart failure and CAT scanning birds that have had strokes. We don't want to do that. I would love if I never have to CAT scan a bird for a stroke again, but it happens, and it's all dietary, and we know that from these studies. Again, it's something we're really trying to change. The side effects of unhealthy diets in the birds are kind of variable. High cholesterol and atherosclerosis are some of the main things that we see. Atherosclerosis is fat in the arteries. So just like people who get fat in their arteries from eating lots of McDonald's and pasta and unhealthy foods, birds can get the same thing. However, having high cholesterol and fat in the arteries can lead to having poor perfusion to the extremities, poor perfusion to the heart. That can cause feather plucking that we just talked about. Isn't it amazing? Everything ties together. Birds that have poor perfusion to their extremities can get those pins and needles, just like a diabetic to their toes or a smoker to the tips of their fingers. And some of them will pluck feathers because they have heart disease. They can also be exercise intolerant, where we say, oh, they're just getting old. That's why they don't fly around as much anymore. But maybe his heart can't handle flying around like that anymore. And again, they can have a stroke. They can have a heart attack from these conditions, which is really scary. We don't like to find and catch birds that have just had a stroke. We want to fix this problem so it never has to happen. Again, fatty liver disease is really, really common in these birds. Fatty liver disease can cause poor feather quality overall, feather plucking. It also can lead into overgrown beaks. So a lot of, again, 20, 30 years ago, everyone brought parrots in for beak trims all the time. And they would do it because the beaks would overgrow and get very long. Now we're starting to understand that when you have fatty liver disease, your liver is not creating the enzyme and the keratin that goes into their beak and their feathers. So when that happens, the beak tends to grow too fast and very fragile and friable, so easy to break. It almost looks like it's chipping and dry and kind of cracked all the time. And those beaks will grow very long, very fast, but not in a healthy way. So 30 years ago, trimming beaks was really common. It was standard as part of our annual exams for birds. If they came in, it was for grooming for a beak trim. We don't have to do that very often anymore if those birds are fed a healthy diet. And I've even seen birds where they used to need beak trims every 3 months, every 6 months. We fix their diet, we get them on the right toys in the right environment. They don't need beak trimmed anymore. it starts to regulate itself if we are feeding them the right thing. There's just so many things other than their GI tract that are damaged by this problem. So talking all about what's healthy and what's not, what are our options? What's healthy? Formulated pelleted diets. Harrison, Zupreme, even Rowdy Bush are very good options for pelleted diets. Of course, Zupreme makes a seed mix. We don't want to buy the seed mix. We want the pellet mix. Fresh vegetables. And in moderation, fresh fruits because they're more sugary and of course more delicious, but a little bit more sugar. And healthy nuts. So most parrots, people always tell me his favorite is peanuts or almonds or cashews or pistachios. None of those are on the healthy list for birds. Some of them are healthy for people, but they definitely metabolize them differently. Walnuts, macadamia nuts, hazelnuts, and Brazil nuts tend to be the best ones. They just metabolize the fats a little bit better. The unhealthy foods, seeds, sunflower and safflower seeds and millet tend to be the top for all of the really small birds. So all the budgies and conures and cockatiels, we hear all about seeds and sunflower seeds. Pellets that are mixed with seeds are still on that list because we know if you gave me a McDonald's buffet with a side salad, I know what's going in the trash. I know what I'm not touching till the end. These birds know that their favorite thing in that mix is the seeds, and they will pick the seeds out first and leave the pellets for last if they touch them at all. Any carbs, starches, grains, meats, seafood, even eggs, which used to be a thing. We're not recommending eggs anymore. Dairy products and human food. None of these things should be in a bird's diet. Again, that's not to say that they can never have anything from the unhealthy column, right? Everyone eats chocolate cake on their birthday. Everyone gets a treat on their birthday or on New Year's Eve or whatever it is. Do I eat cake every single night? No, because I would explode. We can't do that. It's just not healthy. So if we wanted to use these, maybe a little bit of seeds or something like that in a foraging toy where the bird has to work for it for hours to get to that really high quality reward, that's a good use for that. But it shouldn't be a free fed in the bowl every single day. It shouldn't even be available in the cage as a free feed. Because even if they sometimes eat the pellets, we know they're going to gorge themselves on those unhealthy foods first most of the time. So again, if it's not good for us, it's probably not good for them either. Candy and coffee and tea and all these things should not be fed. I know I see videos all the time of somebody's parrot drinking tea with them at the kitchen table. And I think that parrot in that video is also a feather plucker who's half bald. It should just go to show, just because people put it on the internet does not mean it's the right thing to be doing. It's always really hard. I've heard it about 1,000 different ways. I tried this, he doesn't like it. I've tried vegetables, he doesn't want to eat them. I've tried pellets, he throws them on the floor and he bangs his bowl on the cage bars like a prisoner. You have to be patient. You can't give up. Everything takes time to train. It takes time to transition a dog onto new types of food or to get a cat to eat new food. It's not going to be a quick snap on, snap off for a bird. They learn things and they learn what they like. So you have to be more stubborn than the bird. It's going to take time to convince grandpa not to eat steak and eggs for breakfast after his triple bypass too. He's not going to start drinking kale smoothies just because you told him to. He's going to be sneaking his bag of chips into the dining hall, right? Our parents are going to do the same thing. They're not going to want those things right off the bat. But the more you work with them, they're not going to starve. You just have to keep trying different things and make it interactive. Most of these birds, especially the larger species of birds that are very bonded to their owners, really take things from their owners. They want to interact with them. They want to be with them. They want to eat what's on their owner's plate most of the time. If you're sitting there and you're eating your whatever it is, steak and eggs, whatever you're having, and that bird is stomping his little feet across the kitchen table, looking at your plate, trying to grab whatever's on the edge, you're going to have to slide that away from him and offer him a piece of broccoli, offer him a piece of kale, offer him something healthy. And again, if they have a good relationship with you, we always tell people, make it a tea party, make it something where you interact together. Ooh, look, I'm eating kale. Don't you want to try some? Because they feed off of us. They read our behaviors. They see what we're doing and they're like, huh, he's eating that. He looks like he's really enjoying it. Maybe I should try it. That's how they got to eating the steak and eggs with you from the table at the first place. So it really is about being more stubborn than them. As you transition that diet, they're too smart to starve themselves. They absolutely know better. Usually people give in within a day or two, and then they just give up and they go back to it. We do want to do it slowly. We don't want to cold turkey the addict off of their seeds and their people food. You have to kind of slowly introduce more and more and more healthy food, less and less and less seeds, because they're still eating something. They're still eating some of the seed. They're just not eating as much of it, and they're going to get hungrier and hungrier day by day as you lessen that amount, and they're going to start trying the other food. And if you're doing it right, you're also introducing vegetables at the same time. They're also going to try those things at the same time. So you're going to see them eating different stuff, even if they're throwing half of it on the floor. At least they're trying something. So you do have to, it's a tough job, but promise it can be done. Again, the myth is that seeds were an appropriate diet for parrots, and it's okay to share your food with them. We know that that's not true. They've been proven to cause life-threatening illness in parrots. Pelleted diets and fresh vegetables should be the most healthy and should be what we focus on. So trying not to forget that not all bird pets are parrots. Sauerkraut and chickens. And this one is a weird one because, again, I've heard and seen it all on the internet, but most of it is not written by a veterinarian. Sauerkraut is very similar, again, to GI stasis and feather plucking. It is a symptom of something else, not a primary disease. So if we treat it as a primary disease, we're usually missing something else. And for those that don't know, sauerkraut is the colloquial term for when the crop in the chicken's neck that they put food into when they first eat becomes really distended and doesn't empty normally. It usually causes a really bad smell, which is why people call it sauerkraut. And eventually those chickens can lose a lot of weight and pass away because they're not getting enough nutrients. So the myth is that all we have to do is wash out the crop, tip the chicken upside down, dump out the crop, stick him on antibiotics and Tractor Supply, and he'll be fine. And that sometimes works. I'm sure it does. Again, there's a reason people put it on Facebook and Reddit and everything else. However, sauerkraut is a symptom. The treatment is not universal. It's usually where somebody has already tried doing that at home and then they bring them into me. And now I'm stuck with two problems instead of one, because now that chicken has gotten pneumonia from accidentally breathing in the stuff that just dumped out of his crop while he was upside down. And maybe his infection is resistant to antibiotics because he's already been on 3 months of Tractor Supply antibiotics that haven't worked. So it's not always the same. It's not always that simple. There can be so many different things that cause sauerkraut. Again, parasitic, bacterial, and fungal infections, which sometimes get better with regular antibiotics and sometimes don't. Pain anywhere in the body. This is all starting to sound familiar, right? Very similar to our other diseases. Foot sores, arthritis, joint infection, even eggs that are stuck in laying hens can all cause sauerkraut. Toxins. This one I think is probably the least diagnosed because we don't look. Lead toxicity is relatively common in poultry, especially chickens, because we know that they love to pick up and swallow shiny things from off the ground. So all those chickens that are rooting around out in the yard and in the grass, digging up whatever's in the backyard, and then they come across a little piece of a hook from something. They come across a screw or a nut or a bolt that fell off of somebody's wheelbarrow 30 years ago and has been sitting in the soil. They swallow those things and give themselves low-grade lead poisoning, which then causes distension and weakness of the muscles in the crop. So it becomes very loose and very flaccid, and then that material can sit in there and cause infection or impaction. So it's something that we don't test for often enough in chickens, where that sauerkraut's not getting any better. Again, organ diseases like kidney failure and heart failure, the crop is just your engine, your check engine light flashing, telling you to go looking for something else. And yes, specific crop problem. Crop impactions because they ate a bunch of indigestible hay that was supposed to be bedding for the horses and was never supposed to be digested, or eating foreign material like fabric and stuff off the ground. Or again, something as simple as stress. There's a reason it's called a pecking order. The lowest 10 in that pecking order that's getting beat up by all the other chickens can sometimes develop crop stasis just because they're under a lot of systemic and behavioral stress. And so then their GI tract slows down, it's not emptying correctly. And again, they can get an infection on top of that, which can sometimes get better with antibiotics, but it might not be the primary problem. It might be secondary to something else. So in order to determine the cause of the sauerkraut, sometimes different tests are recommended. Sometimes the vet will talk about doing blood work. Sometimes they're going to want to take an x-ray. Sometimes they're going to want to swab the crop for infection. It just depends on the history. Some are pretty standard across the board. Some are not. It depends. If you tell me that your chicken literally has already been to the vet multiple times for swallowing a screw, I'm probably going to be more likely to go looking for that. And the result of those tests will change which treatment we give to which bird, because they're all so different. So again, the myth is that sour crop is just a crop infection. It just needs to be drained, put on antibiotics, they'll be fine. It's not usually the case. Sour crop is a symptom of an underlying disease that then can cause a crop infection secondary, but can also indicate so many other illnesses that most of the time we're not going looking for if we're just sticking them on some antibiotics. All right, moving along. Last group, the scaly friends. And this one, we only have one of our little scaly friends. It's a little bit simpler because most of this is all going to start to sound very familiar. Brumation in reptiles. Again, I know what this is. This is going to get me some hate speech later, but it has to be talked about. Brumation or hibernation in reptiles is just as controversial as all these like parrot diets and things like that, but that's why we're talking about it. The myth is that brumation is a natural seasonal process in reptiles, period, and that reptiles that don't move much or eat in the winter are fine. They're just brumating. They just like to sleep through the winter. They slow down. That's totally fine and normal for all of the reptiles. It's just not always true. Brumation or hibernation is a response to an extreme temperature change, which in theory, our reptiles in captivity should never experience, unless for some reason we are doing it to them, which we should not be doing. And the fact is that losing energy and losing appetite during the winter months can absolutely be a symptom of an underlying disease, and not just because they're hibernating because they got chilly. When we talk about brumation in the wild, it is a stress response that reptiles experience against extreme or unsafe environmental conditions. It's how a reptile's body reacts to changes in the environment that could harm them, so sudden cold snaps and things like that. But it would never happen if the environment did not change around them. They wouldn't just naturally brumate if the environment stayed the same. And it's important to keep in mind that shutting down the body's functions, so literally turning down the metabolism, shutting down, not eating, not doing stuff, is stressful on the animal's body, regardless of why it happened in the first place. In the wild, not all brumating reptiles survive the winter because they're not all healthy to do that. It increases their chances in an unsafe environment, but that doesn't mean they all make it through. It's a very stressful situation for them to put the body through and should not naturally be done in captivity. Most owners don't change the environmental conditions of their tank to mimic the seasons. Most people aren't saying, "Ooh, look, it's December. I should drop the temperature and turn the lights off all day and make it dark really early in the evening and drop the temperature in his tank 16 degrees." Like, most people aren't doing that. So a change in their behavior with no change in environment doesn't make sense. It's not going to say that they're hibernating or brumating if nothing changed around them. They don't know that it's winter if their environment has been the same the whole time. Unless this reptile has some seventh sense for barometric pressure changes in the environment, they just shouldn't know that it's winter if their environment stays the same. So lethargy, lack of appetite, hiding more, like all these things are actually classic symptoms of illness in reptiles and disease in reptiles. Just because it happens in the winter doesn't mean they're not sick, doesn't mean that there's not more going on. Again, most people don't change the temperatures people's temperatures in their houses change. I like to live in an igloo and I keep my house really cold in the winter. But because I know I do that, I have to turn the temperatures up in my tanks every winter. I have bulbs that I use to keep the temperatures warm in the winter so that my tanks don't get cold, so my reptiles don't have to go through this. It just doesn't make sense. It's not healthy for them. So again, causes of brumation that we might be missing if we're just assuming that it's the season. Again, it's all sounding really familiar, right? Infection, like from parasites, respiratory infections, viral infections, all things that would make them either lose appetite or slow down and want to hide more. In older reptiles, organ diseases like kidney failure, liver failure, heart failure. Again, we never used to think that these things even existed in reptiles. We know that these things exist now. Kidney failure is really common in some reptiles. Heart failure has been documented many times in bearded dragons and in iguanas and in some of the monitor lizards. We know these things happen, but we tend to ignore them for a long time if we're assuming that they're brumating and we never get on top of it and then they're too late to fix it. Even things like reproductive disease. So female reptiles that are, their body for some reason has given them the signal to start trying to lay eggs. They often lose appetite, hide more, and want to go sit in a corner. That's not necessarily because it's chilly. It could be that they're dealing with a problem. They're dealing with trying to make eggs, and they might get stuck in that process and need to see a doctor for it, or even need to go to surgery for those problems if we don't get on top of it. Metabolic diseases are also really common in reptiles. Again, it's why we recommend wellness exams so often. If our reptiles don't come in for a wellness exam, we can't evaluate their diet to see if they're going to have low calcium, low vitamin A, and we can't evaluate the lights that we're using to make sure we're not going to get metabolic bone disease, which is a condition of the bones, but also all of their organs that can cause them to be really weak, lose their appetite, start to break bones, and their whole system starts to shut down. More often than not, we miss metabolic bone disease because we're assuming that they're brumating. And again, reptiles get cancer, everybody gets cancer. It's always going to be on our list. Young, old, it doesn't really matter. We've caught bearded dragons that are 2 years old with leukemia. These problems are there and can be not always cured, but treated if we catch them early. If we give reptiles months at a time to get worse and worse and worse, we're usually missing a bigger problem. So again, the myth versus the fact. If a reptile enters brumation, lighting and heating, you should just lower it down. If they look like they're brumating, you should mimic natural winter conditions. Turn the lights off early. You know, don't change the light bulbs even though your house is chilly. Let the tank be 70 degrees. It's okay. He'll be fine. He's just brumating. No, we don't want to do that. We've gotten so far away from doing that. There's some girl on TikTok who shows videos of herself burying her turtles in her backyard every fall. It scares the bejesus out of most of the reptile vets because that's just not necessary for that animal. We don't know, but we might be limiting their lifespan by putting them through such a stressful thing every single season. The fact is that if a reptile shows signs of loss of appetite and weakness and tiredness and hiding and sleeping more, even in the winter, they should really be checked out by a vet to make sure they're not hiding a problem before we start assuming that it's the temperatures and the environment that's causing the problem. So we got through the whole thing in an hour. I don't even know how. But in summary, exotic pets should always have wellness exams every year, even if they seem healthy. At bare minimum, it gives us a chance to catch things before they become a bigger problem. It gives us a chance to make sure that we're not going to have a bigger issue here, that we're not going to miss a problem, and then they're going to get really sick to the point where we can't fix it anymore. Most of the exotic diseases are misunderstood or more complicated than we used to ever think they were. So the more we can get them in early and talk about these things and try to start knocking things off the list, try to start fixing their environment so these problems don't happen, the better we can keep them. And again, a lot of their diseases come from inappropriate diet, inappropriate setup, inappropriate environment, or bad training. So these are all things that we can catch if we can see them for their wellness exams. We can fix these problems before they get to that point. Instead of us fighting an uphill battle as vets, we can really try to get to the bottom of things. So that is the end of our talk. I cannot believe I blew through that fast. I was really trying to make sure we got through it in an hour. I'm not sure, since we had an issue with the sound at the beginning, I'm not sure if I'm able to unmute anybody. I'm not sure if you guys can unmute yourselves even, because I think that was set up before this talk started. But if you guys do have questions, I think there are ways that you can.
Testing.
Oh, can you hear me?
I was just
Hello?
calling in to say I can talk if I wanted to, but I don't have a question.
Okay, well, good. I'm glad we figured that out at least. So we know that we can get talking. That's a good thing.
Can you hear
All
me?
right. So if anybody, Yes, go ahead.
Okay, so you can hear me, right?
Yep, I can hear you. You're all good.
Okay. Okay, good, because I got like 8 snakes, so you're gonna get a question.
Yep, go ahead. Go ahead. Do you have questions, or you're just going to start bringing them in? Because I would love that
Yeah,
too.
I do have a question.
Mhm.
Well, my ball python is actually gravid for the first time,
Okay.
and it's been like really kind of stressful for me, and it's I've heard like horror stories about egg binding and all that, and is there anything I can do just to make sure that when she does lay, it goes smoothly, or
Yeah,
just
so I think the most important things, especially with the snakes when they're, when they're gravid, when we think they're trying to lay eggs, it's really important to try to give them the space to do that. So I think it goes against everyone's natural instinct. Everyone likes the helicopter parent, right? Everyone wants to be involved and check on them all the time and dig through the nest and figure out what they're doing. It's kind of counterintuitive, but that interaction, that constant checking can almost make them not want to do it. So they'll want to hold those things in. They're not going to feel safe to start laying eggs. And they literally will wait. They will wait until the environment feels safe. So sometimes just providing them with that nesting kind of area. So if they normally are kept on paper towels or repti carpet, or if they're kept in aspen or something like that, giving them more of a nest box that you can create with like topsoil. I don't usually like using a lot of soils and loose substrates in my tanks because it can cause more problems sometimes.
I use
But when they
cocoa.
need
I
it, they
use
need it.
cocoa substrate. So
Yeah. So when they need it, they need it. It's good for them to have something they can bury themselves in. But outside of that, if you kind of have to let them do their thing, it's almost counterintuitive, but the less you check on them, the more likely they're going to feel nice and safe to do it.
okay, because she has completely stopped eating too.
And do you know how long?
She hasn't eaten since November.
Okay. So again, it's always kind of a question we ask is if they've been off food for that long, are they just gravid and egg bound? Could they be egg bound, or could there be more going on? And we're assuming that they're gravid or egg bound, but they might not actually be. So sometimes it's worth, even though we don't want to stress them, sometimes it's worth getting a checkup to say, okay, are they egg bound? How many eggs do they even have? Do they have eggs at all, or are we missing something else?
Yeah, because this is all new to me too as well.
Exactly. So that's why I always tell everybody, like, if you're not sure, I feel like the bare minimum is come in for a checkup and we can talk through things, because every situation is so different, right? Every exam is different, every patient is different, every environment is different. There's just so much to it that we can't always assume that, everyone on Reddit's got an opinion, right? But some voices are louder than others. Some of those voices have the training and some of them just don't. They're just really loud. So sometimes getting them in for a checkup, just even if we're not doing a lot of tests, it gives us a chance to get through all of that and figure out how is this individual situation different from everybody else's.
Okay.
And I see I had a couple of people who sent some messages here in the call. So one person was asking if we're seeing birds as patients. We are. So I am working with the Catskill Vet Services, which we have offices in Rock Hill. We have an office in Middletown, New York. And then we also are opening an office in Newburgh in the spring or summer. So I am personally seeing only exotic pets at this point. So I see all the mammals, the birds, the reptiles. We even do fish appointments. We've done surgeries in axolotls and in frogs. So we will do anything and everything. I will see anything that is not a cat or a dog. That is where my experience has been much more limited for the last 4 to 5 years. But we do see birds. We just saw like a cockatiel wellness today. We've seen some cockatoos. We've seen some macaws in the last few weeks. So again, even if you think like, oh, he's 20 years old, he's fine, he's never had a problem. He might come in and yeah, the vet might just look at you and say, yeah, he's kind of chubby. Yeah, he's kind of fat. But we might give ourselves more opportunity to talk about why that's important, what we can change, and what we can do for that pet to give them a better life and a longer life. These animals live so long, it's so worth giving them the chance to live as long as possible and not cutting that short just because they like to eat French fries. And then we have another question. talking about the tea for parrots. I've heard of the chamomile tea. I don't know. Again, it's kind of one of those things that I don't think anyone's done the study on chamomile yet. I'm sure it can't hurt as long as it's not caffeinated and it's not too hot where it's going to burn their crop and all these other things. So it's definitely something that I've heard of people doing. I don't know that it causes actual calmness in them. Sometimes I think it's more of a placebo effect where we say, oh, look, we all had tea together and now we took a nap. And now he's not screaming. I think sometimes they're just excited that they got that treat and they got that time to interact with their owner. And I don't necessarily always know that it causes the same calmness, but I don't think it can hurt either. I was going to say, I'm going through all of these messages here, and I have a message from a former client, and I love her little tortoises being in CT. I miss them very much. I think that, again, the hardest part, the question was, how do we get people to, again, understand that there is routine care, and how do we convince them? I think we have to start considering that these animals live, again, they live so long, some of them, especially the reptiles, the tortoises, the birds. If we were a person and we didn't go to the doctor for 50 years, your doctor would probably have an aneurysm the time you walk in the door, because they're gonna be like, oh my God, how'd you live this long and be this okay? You either had really good genetics or really good luck. So sometimes it's just a matter of saying, like, yeah, just because, cats and dogs get an annual pretty much every year. Most cats and dogs get vaccines every year to 3 years, and that's what keeps them coming in the door. Just because reptiles don't get vaccines doesn't mean they shouldn't go in. It doesn't mean that they don't deserve the same checkups. And there are so many things that sometimes the vet is going to have a slightly more trained eye where we can catch these problems. It's a really good idea. It's a good idea just to say, okay, maybe I didn't notice this at home. There are plenty of times where a bird comes in and their skin is really dry and scaly on their feet. And I'm like, that's not technically normal. And they're like, oh my God, I didn't realize that's just how its feet look. And that's how we open a door to start talking about vitamin A deficiency and how healthy it is for skin and how they only get that if they eat vegetables, and they never eat vegetables if they eat McDonald's every day. So it kind of opens that door to talk about things a little bit more. And then sure, I'm sure there are plenty of people, cats and dogs, that don't go to the vet in between 1 and 3, right? Because you go in as a puppy, they get their puppy vaccines, they go in at 1 year old, they get their booster, the booster lasts 3 years. Now they're good until they're 4 or 5, right? Just because we do that doesn't mean we should. Still ideal even for cats and dogs to get an exam every year. So what makes the reptiles so different? What makes the birds so different? It's still a really good idea for them to come in. So I'm just, I think it's a hard one, but I think it's really, really important. I think the more we as veterinarians talk about it, the more we promote it, and the more we're experienced as we talk about it, the better we're going to be. I don't see any more questions coming through. If anybody else has any other questions, I'm happy to take them. Otherwise, again, we'll probably wrap this up for now. I think it's going to be available through our YouTube channel and available online because it was recording. Yeah, so hopefully we should be able to kind of answer any questions, or we'll take it from there. We'll sign off for the night, and I hope everyone had a really good time. I hope everyone learned something. I hope everyone can go to their aunt or uncle who's got some this, that, the other turtle and tell them, hey, the doctor really said you should go and see them. I know he's 30 years old, but he should probably get a checkup. And hopefully we can start building that experience through the different clubs and groups and Facebook pages and Reddit groups, and kind of get everyone with the exotics a little bit more on board, just like we are with cats and dogs. All right, well, I don't think there's any other questions coming through. So I hope everyone had a good time. I hope everyone learned something, and we will sign off. Thank you, guys.